From the News Channel 5 Network, this is OpenLine.
Hello, everyone. Welcome to OpenLine on Wednesday night. I am Ben Hall. Good to have you with us. Good to be back. Been on vacation, then we had a long trial that we covered here on the Plus. Tonight, we're live, a chance for you to call in with your questions. We have a good topic. We're talking about children in Tennessee. How are they doing? A new report out lists certain categories and gives us an indication of how kids are doing in Tennessee. The Kids Count report, you may have seen it in the news. Tonight we can go more in depth and really talk about some of the issues involved there. Happy to have with us Linda O'Neill with the Tennessee Commission of Children and Youth on Children and Youth. Thank you for being here.
I'm pleased to be here.
So bottom line, takeaway from this report, what is it for children past year in Tennessee?
So the 2016 Kids Count report shows that Tennessee's ranking compared to the other states has slipped a little from 36 last year to 38 this year, and that's largely due to some worsening economic indicators for children and families.
So there are 4 categories you judge.
There are 4 categories. This is a report done by the Annie E. Casey Foundation that compares all 50 states on the best available indicators that reflect outcomes for children and families. And there are 4 domains in this. One is economic well-being, education, health, and family and community.
And so we slipped primarily because of the economy, the economic well-being of our children. Is that right?
That's correct. And compared to the rest of the states and compared to ourselves from 2008 until the data in this report, we saw more worsened in terms of children in poverty. 1 in 4 children in Tennessee lives in poverty. In terms of the fact that 1 in 3 children has a parent who does not have secure full-time employment, and about 1 in 3 lives in a family where the household has a high housing cost burden.
Now, because I looked, I know we ranked 42nd out of 50 states.
Right, 42nd on economic well-being. It's our worst ranking.
So you've done this a while.
I have.
You've been on this show before. You've done this a while. How are we doing when you see that? How does that compare to when you started? And what's the trajectory here?
So over the years, we've seen improvements in Tennessee. For many years, we ranked in the bottom 10 in the 40s. For the last several years, we have kind of bounced up and down, never higher than 36th. This year, 38th. We were 39th one year. So what we do know from this report is that good public policies and successful public-private partnerships can make a difference in improving outcomes for children. And in this year's report, there are several categories where we've seen improvement, and it's because of some of those factors.
So that's right. I mean, there were many years where we were in the bottom 10 in everything. Right. That was. You feel like we're making progress in that regard?
I think we're definitely making progress in Tennessee, but what this report shows us is there are still a lot of challenges for many children and families, and there are things we can do to improve that. What we know is the Great Recession hit Tennessee pretty hard, and the economic recovery has been uneven, and those who are less fortunate have certainly been more challenged to recover from the recession. Even though unemployment's low, there are not well-paying jobs sometimes, and what we know is we need more of what gets referred to as a 2-generation strategy to help both children and their families. We need to help parents develop the education, job skills they need to get better paying jobs, and at the same time their children need quality early childhood education so they can be in a safe, stable, nurturing environment while their parents are working. And
you've said that we need to put more money on the front end instead of putting money on the back end. Kind of address problems early on as opposed to addressing them after they've already happened. And that, I mean, the best example there would be building prisons, which are certainly necessary, but boy, it'd be great if we needed fewer of them by investing money early on.
That's absolutely true. There are some efforts going on in Tennessee now that gets referred to as building strong brains. Tennessee's ACEs initiative. ACEs are adverse childhood experiences, some of the kind of factors that are somewhat represented in the report, but are also the kinds of conditions, different types of abuse and family dysfunction that really have an adverse impact over the lifespan. And we know really Tennessee's future prosperity depends on what we do for children and families today, and the way we can help really develop strong, sturdy brains in children. We know brains develop much like building a house. You lay the foundation, you frame the rooms, and you wire them in a predictable sequence. So when that gets disrupted in children by adverse experiences that really create what the scientists now call toxic stress, it adversely impacts the architecture of the child's developing brain. And that really has lifelong consequences. It makes good performance in school more challenging, and it really affects lifelong health and well-being, and children or adults now who've had high incidences of ACEs actually have a shorter lifespan even. So it really stresses how important it is for us to prevent them whenever possible, and when they can't be prevented, to wrap services around the child and family to help them recover from that.
And I want to talk about that more as we go on, this whole notion of toxic stress and its impact on children. But as far as this report, which again you've been putting out for a while, do you feel satisfied that people listen, that the legislature reads this and has taken action over the years? What you put it out on a regular basis. How do you think it's received?
I think that the data is very helpful for people who are writing grants, for who are identifying problems that need to be addressed, for validating those needs. And I think there are legislators who pay a lot of attention to it. During the budget discussions this past year, we had legislators who essentially said, you know, at that point before this report, our children, we ranked 36 for our children. We need to do better than that. And we do need to do better, and we can, and I believe we will, as we really target resources in effective ways to help improve outcomes.
So we mentioned 4 categories. Economic well-being, we were 42. That was where we were worst.
Right.
Another one is education.
Yes.
We're 36 there.
We're 36 in education, but in each of the 4 domains has 4 indicators. And in education, we made improvements in 3 of the 4 domains. We have had improvements in 4th grade reading proficiency and 8th grade math, and also improvements in Tennessee in on-time graduation. The one category in education that got a little worse from 2008 to now is the percent of 3- and 4-year-olds who are in quality early learning experiences. And we know this is an area that can really make a tremendous difference, where the return on investment can be really impressive. And the legislature this past year took some steps to improve the quality in pre-K programs in Tennessee. We know quality is important in these programs, and so they passed legislation to strengthen the parental engagement and the curriculum and other factors to ensure the pre-K programs are of high quality. And so this is a good first step, and then what we need to do too is to, as quality improves, we need to expand the availability of pre-K, and we also need to work on the quality in the child care, what gets referred to as the daycare programs.
Hasn't that been an issue that's somewhat, I guess, talked about, perhaps controversial, pre-K, the notion of how effective it is? There's some lawmakers who say, oh, it's not that effective.
There have been questions and studies about that, but what the study did show is that the children who participated in the pre-K programs entered kindergarten better prepared to learn. And so there has been what gets referred to as fade out in terms of the academic outcomes as you move up to 2nd grade or so. But there's other research in other areas that shows over time what's more as important as the cognitive skills are the social and emotional development. You really can't do one of those without the other. They're very much intertwined, and as we strengthen all 3 of those factors, we improve outcomes, and it really speaks to the need in K through 3 to strengthen the curriculum and the family engagement and the efforts there to ensure that children who have entered kindergarten better prepared because of pre-K are able to sustain those gains, that they're not bored and lose some of that because they have to wait for the teacher to bring along children who were not able to go to pre-K because it was not available, so that we keep a high quality pre-K through 3rd grade to enable children to develop the social, emotional, and cognitive skills they need to really succeed in school.
So this report's saying, yeah, quality pre-K is important.
It is
important. It does help. Then another area, we'll kind of go through the areas and then kind of delve further into other things. You have economic well-being, where we're 42. Education, where we're 36. Then health. That's another of the categories, or health, we're 28. That's where we did the best.
Health is the category where we did the best, and we're in all 4 indicators we improved from 2008 to the 2016 report. And those 4 indicators are low birth weight babies, where Tennessee has made substantial improvements, but we still rank 43rd nationally in low birth weight babies. We still have tremendous opportunity to make improvements there. We also have had improvements in some areas where, as a result of good public policies and preventive efforts, we've seen an environment that enables adolescents to make better choices that have contributed to some improvements in adolescent substance abuse, the percentage of adolescents who are abusing alcohol or drugs. And also we've seen improvements in the child and teen death rate, and the primary, the leading cause of adolescent deaths, motor vehicle accidents. And as we have in Tennessee prohibited texting and driving, and we have mandatory seatbelt laws, and we have a graduated driver's licensing program that requires requires adolescents who are getting their driver's licenses to have more experience before they drive on their own, limits the number of other passengers in the car. Some of those things we can really help reduce motor vehicle deaths.
That all plays into health.
It all plays into health. The other factor, though, in health is uninsured children, and we, while that's one of the categories where we rank better than the nation as a whole, we still have 78,000 children in Tennessee who do not have health insurance coverage. And it really tells us Tennessee needs to find a way to take advantage of the Federal Affordable Care Act funds so children and their families will have access to health insurance. And while most of those children are currently eligible for TennCare, their families don't know that because they know they're not eligible. So any family that has children who don't have health insurance should be applying for TennCare because their children may in fact be eligible and then have access to health care. But the research is really clear that when families and when parents have health care, they're more likely to have a culture of being appropriate health care users for preventive care, early care, and not have to resort to the more costly use of emergency rooms.
So that's a pretty important statement. Take advantage of the Affordable Care Act, another thing that the legislature has certainly debated a great deal about. All right, we're going to take a break. We have one more category. We'll talk about that, family and community, how we ranked there. And then we want to hear from you as well. 615-737-PLUS. 615-737-7587. Take a break. Be back right after this.